Madam Chairman, I'd like to offer an amendment in the nature of a substitute for my legislation, the Transparency in Coverage Act. It amends the Employment Retirement Income Security Act of 1974, or ERISA, by codifying a Trump administration rule with the same name. Transparency in coverage will give patients and plan administrators real-time access to prices for medical services and prescription drugs in advance of care. This committee remains committed to lowering health care costs for working American families. The Health, Employment, Labor, and Pensions, or HELP subcommittee, has already held multiple hearings in this 118th Congress focused on price transparency and affordability in the American health care system. The first pillar of this bill is transparency in medical services. Under the current system, two patients can get the same procedure in the same hospital but have completely different costs, with their insurance plans covering vastly different amounts. Americans know that this is ridiculous, and they're tired of finding out after the fact what insurance plans will actually cover. Healthcare plans should provide beneficiaries with detailed out-of-pocket cost information and negotiated rates for covered healthcare services. Beginning in January of this year, requirements from the Trump rule have been enforced, such as publicly disclosing contracted prices and creating cost-sharing tools. Still, the provisions need to be codified into law, which is what my bill does. My bill also improves the usability of the data that healthcare plans are starting to report. Unleashing third-party developers to create innovative apps and tools to share this health data will improve the patient experience. Unfortunately, the Trump rule provision regarding prescription drug pricing disclosure has been indefinitely delayed by the Biden administration, and that brings me to the second pillar of this bill, transparency in prescription drug costs. Passing H.R. 4507 will enable full implementation of prescription drug cost reporting. Additionally, it would bring much-needed light to backroom deal-making between pharmacy benefit managers, or PBMs, and pharmaceutical manufacturers on rebate pricing. PBMs do not have the best interests of patients in mind. The Transparency in Coverage Act is a critical step toward promoting transparency and affordability in health care. When patients can see who offers the best prices, the market can respond to the demand for lower prices. By requiring increased price transparency for providers and oversight of PBMs, we can empower patients with the information they need to make informed decisions and reduce health care costs. I urge my colleagues to support H.R. 4507, and I yield back.
Thank you, Mr. Good.